Dr. Tour from Amplify Eye Care here in Olympia, Washington. Today we're going to talk about a condition that's called presbyopia. And so usually presbyopia hits after or around the age of 40. And that's when your near vision starts to become blurry. So kind of anything within arm's length starts to become blurry, and you might find yourself pushing it further back to be able to see it clearly. So that starts happening because the lens in our eye actually starts to harden and becomes less flexible. So then that lens isn't able to focus at all the distances it was when we were younger. Now, the easy solution for presbyopia is reading glasses, and you can do it in a few different ways depending on your prescription for the distance. So some people don't need prescriptions for the distance, and they can get away with just using over-the-counter readers at the store. Now, depending on how far along in presbyopia you are, you might need a stronger prescription or a lower one. But then the other option, if you already wear glasses for distance, is either having two pairs, one for the distance, one for up close. And then there's also multifocal lenses, which are either bifocal or progressive. So the bifocal lens is the one that you typically see that has that line in the center there. So that top portion is for distance, and then that bottom section there with the line is for reading. Progressives are similar in that design, but they don't have the line. It's all just kind of like a blended gradient that works really good and also gives you a little bit of that intermediate distance for computer and things like that. So all of these are good options, and it kind of just depends per person and how you're using your eyes throughout the day for which one best suits you. And then you do have a few options in terms of contact lenses as well if you're a contact lens wearer. So one option is still to use just readers over top of your distance contact lens prescription. The other options get a little bit more complicated. First one's called monovision. One eye is focusing for distance and one eye is focusing for up close. And while that sounds a little bit weird, a lot of brains actually adjust to it really well, and you get a little bit of both without having to wear glasses. The biggest con with monovision is that you're giving up a little bit of your depth perception, so it takes a little bit more getting used to. The other option is doing a multifocal contact lens. So both eyes are seeing distance and near. It just kind of depends on which one you focus on. Some patients find no problem with these lenses. Others have a little bit more trouble adapting, mostly due to some kind of like ghosting and shadowing on letters and things like that. So if you are finding yourself having some trouble with your near vision, know that there are all these options out there for you to try. It just doesn't mean bifocal reading glasses all the time. There's a lot of different options, but each person has different needs, so we can focus on what your needs are at the time of your exam.